The main difference is that with a virtual visit, the virtual doctor or provider can't touch you, and they can't smell you, and they can't do some of the tests that they would do in person. That said, with the right types of attachments, the right types of peripheral devices, stuck onto your computer or whatever else, or your mobile phone, actually a lot of the things that they could do in the office, they now can also do over the internet. Easy example is, so right now a doctor can listen to your heart and lungs over the internet, they can look in your ears or your nose or your throat, they can examine your skin very closely, they can check your vital signs remotely. So almost all the things that would have been done in an office or even in a hospital in terms of the doctor's exam, their physical examination of you, can be done virtually at this point. They cannot, so if your stomach hurts, they can't push around on your stomach, but you can, or somebody like an assistant or a helper can, and they can actually still tell a lot from that exam, even if they're not the ones doing it. And then there are aspects of different types of subspecialized exams. So for example, a neurological exam or some other things where historically doctors have assessed it, they'll assess your strength, and that is a somewhat subjective assessment, right? Because they're measuring your strength against their mental catalog of all the people they've ever tested before. There are still ways, and neurologists have been really great about this, about coming up with other ways to examine patients remotely that enable them to get some of the same information. That may not be a perfect approximation of exactly what they could have done if you were in their office, for example, if you were in their neurology office, but they can still gain useful information from that, potentially order additional testing. So I would say overall, across most, but not all specialties, there's very little difference between a virtual exam with the right additional devices or assistants or whatever else there, or the correct participation from the patient, and what would be done in an office. If you're talking about whipping out your phone and just having a quick video call with somebody, and they're not going to examine you, and they're not going to check your vital signs, they're not going to do any additional tests, or they don't have the ability to order or do these additional tests, then there is a difference between what you would get virtually and what you'd get in the doctor's office. And you should just be aware of that, right? So it is still appropriate for many types of questions, but there are other questions where no, you would need some additional information to really make an accurate determination. And that's the kind of thing where if you have a question about that, if you're not certain, it's a good question to ask your doctor in the moment that it's occurring, right? Is there more information that you would normally be able to get if I came to your office that you can't get this way? And I would hope that the majority of doctors are going to be honest with you about that answer.